Hey, I'm Jessica DeMassa, and that's Matthew Holt. And with absolutely zero prompting and somebody who does not have 20 years plus of experience in the health technology space, we've decided to launch a brand new, never before seen show covering all of the fundraising deals and healthcare technology and innovation.
What's it called, Jessica?
Health Tech Deals.
And this has nothing to do with any other show that we did that was, 240 episodes plus of talking about health tech and some of the funding.
Not at all. It's a brand new beginning. The January 12th, first ever episode of Health Tech Deals.
So Jessica, it's completely a first for us to be doing a show together. I have no idea that there was anything that ever happened before this. Do you remember anything?
Oh, old man health tech. The memories that we shared in those 247 episodes. Why we would not just wait till 250 is beyond me to change the name. But it's been done. And those 247 episodes shall be archived. Do you remember the time we did the one in the train station in Helsinki at Europe? It was midnight. We did that. We were finished. Remember?
Oh, we were finished.
For the time in Sitges where you were so drunk doing this, you could not even understand yourself when you watched the video back.
That was almost close to midnight as well. Excuse me.
There was the one when everybody went public, when Livongo went public. Remember that? We celebrated that. Or when Teladoc hit $200 a share back in the day, and then they acquired Livongo. We would celebrate all that stuff. There was a time in the pandemic when there was like several $1 million invested into mirrors, and we thought the world had freaking gone crazy.
I'm not sure the world hasn't gone crazy. I do remember the one at Health 2.0 for the 100th episode where we had all those guest stars. We had like Eugene Morovich, Daniel
Ultimate Takeover,
Rasu Shrestha, and Kyra Bobinette. And you went down them all without letting me talk. And every time you got to Kyra, she just went, pass.
Oh, the good times. The good times.
Yes. All right, but
that's okay. We have a new beginning. We're gonna get new people to watch us, and they need to just So we're in a better place.
Can you explain to me exactly how this is different? Because are we going to do a whole different type of description of the deals, or no?
There is no difference other than the name, and we changed the beginning.
It's still 2 minutes of standard chaos. Well,
it's a lot of bullshit with 2 minutes about the deals of the week. Enough reminiscing. We're gonna cut out part of that flashback here for those of you watching at home. Let's catch up with the numbers for right now. The funding reports came out. Startup Health's report came out, says $44 billion for 2021 invested into digital health. Rock Health has a more reasonable $29 billion.
You're missing Galen Growth, right? That's from Asia, who said it's $48 billion. So, I mean, who knows? And we're probably missing a whole bunch of deals in India.
Oh my God. Well, it just depends how you define it, right? That's always been the issue.
Well, but that's not even counting the IPOs, which basically with the SPACs this year have all been essentially extra venture rounds, right? It's going to be down rounds later, but that's a separate. That's beside
the point. That's beside the point.
And I think it's interesting that the stock market is continuing to collapse, although they're a bit up. Things have been a bit up today. But in general, the market's been really, really down. I mean, down sort of.
Yeah, but Matthew, on this venture funding piece of it, what do you think is going to happen this year? Does it go higher? Stay the same?
Just look at what's been raised, right? A $2.5 billion fund plus from Andreessen. Catalyst is sitting on stacks of money. Oak's still sitting on stacks of money. Tiger is going to be, Koatu or whatever they call it. I mean, any number of companies, people are still coming into digital health. The question is, if you look at the public markets, are they going to recover? Are the private companies going to buy the public companies? What on earth is going to happen? I guess we will find out.
The suspense is killing me.
All right. So we're going to do this?
Yeah. Let's do the 2 minutes. So for those of you who may have just found us for the first time, because we actually have a name that you can say and spell on the internet, what we do is set the clock for 2 minutes. I ask Matthew Holt all the questions I can about the funding deals, and he answers them. Go. Transcarent gets $200 million in a Series C, brings their total up to $298, valuation of $1.6 billion, more than Accolade. Matthew Holt,
Well, more than Accolade today. I'm not sure, although Accolade's up a bit on some good numbers, but I'm not sure it's more than Accolade, where Accolade was 6 months ago. You know, it's a little bit payback, right? All the people who made money in Livongo are back in here, Kinetic, and obviously General Catalyst and much of this. A bunch of hospitals are in this one, presumably hoping to be the hospitals that get sent the patients by Transcarent, because otherwise they may be cut out. I mean, yeah, they take $300 million. My sense is Glenn and his team there are going to have to, you know, they're shooting, you know, he's an old guy. They're shooting for a long-term thing here. They've got to, yes, he's a good-looking, young, healthy old guy, but you know, they're going to have to build a company that's going to be around to like essentially replace health plans in the employment sector. And that's a long go, and they've got a lot more to add to that, right? They're going to have primary care and a bunch of telehealth and other stuff. So fascinating deal. The good news is he can't buy Accolade, because then he'd have to admit he'd become a navigator, and then Owen Tripp would laugh at him.
It's true. I have an interview with him. Check that out on my channel. Medically Home gets 110 million. Matthew Holtz, lots of money flying around here. What's their total?
They're around 275 now. This is doing the hospital at home. Kaiser and Mayo invested. This is growth capital, but coming from Baxter and some big medical giants. I think, you know, this is getting serious now. All hospitals care about this stuff given post-COVID. And a long time since I had Rami and Pippa on stage with me at Health 2.0, where I fake being an old person.
All right, Vera Whole Health buys Castlight for 370 million. This deal is shrouded in mystery, mostly because nobody knows what Castlight does anymore.
How the mighty are fallen, right? First ever digital health IPO, $1.5 billion valuation, goes out at about 350 million. Some kind of navigation, and somehow that makes sense for Chase to buy it. Sorry, not Chase, but the Chase-backed medical group, which in itself is a weird thing, because it's like the number 6 or 7 of the new startup medical groups. It's not Oak Street or Iora or One Medical, one of the big ones. It's a strange deal to me, and I guess it was cheap enough, and they got some money in from Anthem and from the private equity group, and you know, who knows what. I don't see this one moving the needle much, but what it is particularly interesting is a private company buying a beaten down public company. And we've been kidding about it, but when you look at the numbers, it's got to be tempting with some of these private companies sitting all this cash to think about doing a reverse merger into one of these public companies, or buying them outright and taking them private, because some of them are beaten down so much compared to the private market valuations. So yeah, it's a big day of deals. By the way, we didn't get to the biggest deal of the lot, which isn't really a kind of digital health deal, but an old world deal, which is Stryker buying Vocera, $3 billion, you know, for a big medical supply company to buy a communications company in the hospital system. A lot going on, but I guess we're starting as we need to go on, right?
I guess so. Way to sneak that one in there.
Well, you know, we went.
Maybe you shouldn't have been so ageist against Glenn Tolman at the beginning. It would have fit in the 2 minutes.
Okay, you call me the oldest curmudgeon in healthcare. Glenn Tolman's older than me. I know he's fitter, younger, better.
He doesn't look it.
What?
You're falling apart.
Exactly. I mean, but what I'm saying is a serious point, right? Is that, look, when they took Livongo, I mean, Livongo raised less than 100 million. You know, they were at a $6 million round, an $8 million round, and a $12 million round. They didn't do one of these massive rounds when they were building it. And they grew it grew super fast in 2015, 16, 17, 18, you know, all the way to its IPO. The stock went crazy, obviously, you know, in the early part of the pandemic, even though Glenn was on record yesterday saying that, you know, the pandemic hurt them, which I'm sure is true, but whatever. But the point is, right, they grew that a little bit. They had a relatively low valuation. They went out at a valuation of just a little bit more than what the current Transcarent valuation is. And then the stock could go up. Hard to imagine the stock dramatically going up from here, you know, unless there's massive revenue growth. Did he talk to you about revenue?
A little bit.
I mean,
well, I put him on the spot because I said that, you know, there's a lot of people who are going to question the valuation, that especially because they haven't been around for more than a year and nobody knows who their customers are. I mean, they've got, I think, Deltas, and they've got a bunch of customers that came over from Bridge, that acquisition. And so he said he's got some more announcements coming his way for some big customers that are going to surprise us. He says he's got some partnership with the most innovative payers, whatever that means, coming our way too.
It seems to me is that, you know, it's a bet on the fact that the big employers are pissed off with their health plans and are basically going to end up replacing them, right? Now, there are some functions they may or may not be doing, like the claim stuff and the benefits management.
Yeah, but the rest of it.
You talk about the care management part of it. and delivering that to either their affiliated hospitals, you know, who they're going to get good deals from, to like the drug side with the Walmart discount, to the you know, and to the telehealth people, which they've got to deal with SiriusMD and who knows what else to do. Eventually, like Accolade, they'll probably have to build in some kind of other primary care piece. But, you know, they are looking to me like they're building what Jonathan Bush, to quote somebody Glenn Tillman loves to death, would call, right, the 21st Kaiser without the bloat. They're kind of going down that path as well, as are, back to something that you have said many times, all those virtual primary care first companies with a side of mental health, built on the new platform, blah, 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 ta-da. I mean, they're all heading that direction, and they're all betting on a massive realignment of American healthcare, which, you know, we've been waiting for decades and may or may not be coming. But that's what this is. This is not a quick, they're not going to flip this on the stock market next year and everyone get rich.
Although he said, he clarified a comment that he made that I read about the fact that he said that Transcarent would be in just about 1 year, where it took Livongo 3 to 4 years to get. And so far, he's not wrong.
Well, that I might believe, right? Because the first couple of years at Livongo, they were kind of fiddling around, figuring out the model. When they hit on the right model, got the deal with the PBMs, and then started selling lots and lots of employers, I mean, that was good. On the other hand, is they're coming into a much more mature market, right? Where the employers are now have seen Livongo, they've seen Accolade, they've seen Included Health, Grand Rounds, they've seen, you know, any number of other companies doing kind of a combination of primary care, and the health plans are reacting as well. The health plans are doing stuff. So, you know, it's a big bet. Having said that, it's a big bet from a bunch of people who already made so much money off the last bet that they're kind of playing, well, they're getting a little bit back of the house money. It's only 300 million in from all those people when they took
how much?
How many billion off the table already? 5 to 10 between them. Yeah. So,
true.
You know, it's a bit like you buying 10 more shares of Tesla just to off the winnings you already made.
Life-changing. All right, can I get us out of this, because this is spiraling out of control here?
All right, well, that's the whole point of Health Tech Deals. It's 2 minutes of pithy stuff and then a lot of bullshit.
A whole bunch of bullshit. Yeah.
We all have to go watch your interview with Glenn Tillman to find out really what he said.
Yeah, wouldn't it be nice if you could watch that before we recorded this?
If you wouldn't have you'd have let me see an early edition rather than hiding it.
No, I honor embargoes.
From me?
Especially from you. Are you kidding me? You have like the biggest mouth in the industry.
Rubbish.
Yeah, you're not known.
Just in case anybody from a PR agency watching this, I always honor my embargoes, even if Jessica doesn't. All right.
For proof that is not always true, follow him over there at BoltyBoy on Twitter. You get the veiled, coded tweets that he puts out there where he knows something, but he's not saying he knows something, but you know he knows something, and that's what he wants you to know. Yeah, those are great. Follow along for that. I'm over there at Justin Massa, keeping silent until I have permission to say things. And if you want to keep up with these Health Tech Deals episodes, never miss one by subscribing to our email newsletter over there at thehealthcareblog.com. You can just sign up, click email updates, enter your email address, and you'll get these shows, plus my WTF Health interviews and all of the content from the blog for the week delivered directly into your inbox on the weekends.
Your first show? It's like we've been practicing 247 times, and did we get it right?
We finally nailed it. Perfection is here.
All right, we better say goodbye.
Bye.